The campaign to get £250,000 a year drug on the NHS.
It sounds really corny to say, but it really is life-changing.
Good evening and welcome to Spotlight. The drug helps patients with a rare kidney disease, but can the NHS afford it?
A Devon woman with a rare kidney disease is campaigning for the treatment that's changed her life to be funded by the NHS. A South West kidney expert describes the drug as a magic bullet, but it costs £250,000 a year per patient.
Health ministers won't approve central funding until medical watchdogs decide if it's affordable. Our health correspondent Sally Mountjoy reports.
Life's been transformed for Elena Lilly, who lives in Barnstable with husband Gavin. She has a rare kidney disease, aHUS, and treatment used to mean going to hospital in Exeter 3 times a week for blood plasma exchange. It took 4 hours a time and didn't improve her condition. But since joining a clinical trial for a drug called Eculizumab 3 years ago, just 1 injection every fortnight has changed everything.
It sounds really corny to say, but it really is life-changing. I've got energy to do things, I can go away. When I was on plasma exchange, I was so tied to the hospital. It was really hard to have a life.
But Eculizumab costs £250,000 a year per patient, and health ministers have decided not to fund it on the NHS yet. Elena's doctor says that's a shame.
I think that it's a magic bullet really for this particular condition. It really has been proven to show dramatic improvement in both the condition, in the kidney function, in the quality of life. We were quite disappointed that it hasn't received central funding when the decision was actually made, and we're certainly hopeful that this will be reconsidered.
The Department of Health told us ministers had accepted the clinical effectiveness of Eculizumab but needed further advice to take account of its cost, benefits and affordability. From April, NICE will look at very high-cost drugs for patients with very rare conditions and will evaluate the drug. Felix was diagnosed with aHUS at 6 months. His mother says he lost nearly 3 years of his childhood travelling from Exeter to Bristol Children's Hospital up to 3 days a week for plasma exchange. He's recently been granted temporary funding for Eculizumab. His mother says the high cost is justified.
How can you put a price on somebody's quality of life? The children that, especially children, just giving them their childhood back.
While only around 200 people in the UK have the same rare disease as Felix, a historic genetic defect means 20 of them are in Devon, and more diagnoses are expected here. NHS Devon says while it's waiting for a ruling on funding, it'll consider requests for Eculizumab case by case. In the meantime, an online petition calls for the drug to be available for all without delay.
And Sally joins me in the studio now. It's a huge amount of money to treat one patient for 1 year. Why is it so expensive?
Well, the medical director of the company that produces this drug said that they'd spent 15 years developing it and researching it. And it's very expensive and it's very difficult to produce. Add to that the fact that it's treating people with rare diseases, so it's never going to have the volume of sales that a medicine that treats a common condition with. Compare it to, for example, statins, the wonder drug for high cholesterol. Now millions of people are on that, so the cost has been brought down.
If someone's treatment goes on for a long time, I mean, the cost is going to mount up to millions. Some people might argue it's going to be hard to justify that when the NHS is under so much financial pressure.
Well, this is the ongoing moral dilemma that the health service faces, that as research produces more and more breakthrough treatments, maybe we have a declining ability to pay for those. Now, at the moment, with the pressure on public spending, we know that the NHS is having to make bigger savings than it's ever had to make before. £15 billion until 2015. So can we afford it, because we're now talking about a drug that costs £10,000 a fortnight? Some will argue that we simply can't afford to pay for this out of the public purse. Other people will say we can't afford not to, because if medical science is producing these extraordinary drugs capable of transforming people's lives, it's unethical to deny them to people who have these rare and disabling diseases.
OK, Sally, thank you very much indeed.